I want to make a case for the need for nutrition education, and I want to use a case study based on something that happened in India. It is imperative that people in health professions know about this, and as adults we should speak to health professions about it. Now, what is the case? The case is about Jyoti, who was an 18-year-old young woman who suffered from severe iron deficiency anemia during her pregnancy. She had been to an antenatal clinic several times and was given iron and folic acid tablets and some nutritional advice. She was then sent back home and no proper investigation was conducted at the clinic. Eventually, she had come back to the clinic with severe difficulty in breathing, swollen feet and heart failure. Unfortunately, she died during pregnancy. Now, iron deficiency anemia is a major nutritional problem in pregnant women in India and a significant cause of maternal mortality. Indeed, it is a global problem affecting over 500 million people in the world, and particularly in pregnancy, we know that iron deficiency anemia can cause a significant cause of difficulties which might be fatal. Sometimes the baby is likely to have low birth weight. So the problems of Jyoti is not unique. It is only unique in a sense that this happened so suddenly and a while before she was doing well. But that is not entirely true, because now there are many people like her, and reports also indicate that there are similar cases with iron deficiency, iodine deficiency, zinc deficiency, vitamin A deficiency and many more, which are the most common micronutrient deficiencies in the world. So in Jyoti's situation, what were the immediate causes? The immediate causes are simple to recognize, which is diet-related severe anemia in a young pregnant mother. And the underlying causes were widespread ignorance in the community as well as some attitudes that did not help. Particularly the fact that when women are given iron tablets during pregnancy, in a community where Jyoti lived, there was this notion that the iron tablets were not useful and necessary because their mothers did not take them or they did not taste better. So on and so forth, the reasons went. As a result of this, one way or the other, they were discouraged from actually taking these supplements. So in the case of Jyoti, another problem was lack of proper diet and its food security. But an individual's diet is even more important. So that even if people are poor, when they are taught how to put together a good diet to help them, it can improve their livelihood. In addition to it, this young pregnant mother was not properly investigated and was only given supplementary tablets with a little bit of counseling. And in post-screening, the investigator might have been negligent. He wouldn't have properly known that the problem was more serious than what they had actually thought. So she had to do with the routine medicine she was given for pregnancy, indicating a breach in the healthcare delivery system. To summarize the reasons, poverty, ignorance, inadequacy in the healthcare delivery system had led to Jyoti's condition. These basic cores are therefore very much relative to the healthcare system and issues around governance and policy that have to be considered too. So, how do we become aware of the problem? What is the awareness surrounding this problem and the visibility of the problem? First of all, at the individual level, there was a lack of knowledge and awareness of the nature and the severity of the problem. If she had known that whatever the problem was that could have led to her death, she would have done something about it. And so would her friends. And her social network consisting of her family and peers wouldn't have influenced her by discouraging her from doing the necessary. The attitudes at a community level and certain perceptions of the dietary supplements and dodgy behavior to certain food groups were also evident in her village. For example, in her village there was this general notion that green leafy vegetables are not good for mothers and that again, green leafy vegetables will make the baby big. In reality, green leafy vegetables are a good source of folate in the diet, and so in fact it is more helpful than being harmful. In addition to it, there was a problem of professionals carrying a poor assessment and nurses lacking capacity in nutrition knowledge and nutrition education. I would like to strongly emphasize on this The health professionals need to have some knowledge of not just health education but also nutrition education so that they can actually handle these cases better. And at the level of policymakers, I think there is a case here for the government to look at in terms of the issues that are raised. India is one of the high burden countries for maternal mortality due to poor nutrition. And we know that there are issues of governance as far as nutritionists are concerned and issues of capacity, which was demonstrated in a landscape analysis of WHO and FAO and other agencies in the year 2009. So, how do we approach this? What is the plan now? How can we solve this? I believe that there are specific nutrition education problems which we have identified here, particularly in relation to diet, ignorance, dietary behavior and so on. But the plan will be simple, that is to have an integrated nutrition education program embedded into existing programs. Now, within the healthcare sector, there are a lot of programs focusing on maternal and child health. There are programs which are specifically focused on education. For instance, Jyoti was an 18-year-old woman who got married at the age of 15. It means a girl like her who should be in school could actually have a good education, and that would have prepared her to be aware of and easily handle issues like this, and of course would have prevented it. We need to take a serious look at the food security programs and livelihood programs in India to use it as a channel for incorporating nutrition education programs. There are numerous programs, a few such as the Integrated Child Development Services Scheme, Anemia Mukt Bharat Program, National Iodine Deficiency Disorder Control Program can be incorporated with nutrition education rigorously in their structure of implementation. However, we need to train and build capacity among health workers, particularly in nutrition education, among nurses and doctors as well as others working in the health sector. People from agriculture sector where nutrition is important also form an integral part of the nutrition education intervention. To do that, first, we must have a need assessment to be carried out to plan a specific intervention. In this case, we need to investigate the issues around pregnancy, issues around why women in pregnancy, particularly in Jyoti's village, fail to take their supplements and proper diet. It is also important to analyze the cause and reason behind certain notions and actions of people in Jyoti's village. Following that, we can plan and formulate a nutrition education intervention that is more suitable and compatible to the lifestyle of the people in that village. This can uplift the nutritional status of the people, help them modify nutrition-related maladaptive behavior, and abolish food-related taboos. Ultimately, what our nutrition education program aims to achieve is to improve the nutritional status of pregnant women and prevent maternal deaths caused due to anemia all over India.